Hi there, and welcome back to my channel. This is Empowered Health with Valerie Grave. Today, we're going to talk about arthritis and how you diagnose it. This is part two of a six-part series. Let's dive right in. All right, so the diagnosis of arthritis, as with the diagnosis of pretty much anything, listening to your patient, okay? If you feel like you go to a doctor who doesn't listen to their patient, then you need a new doctor, all right? Simple as that. They teach us in school that 90% of the diagnosis is the history. That's what we call it when you listen to your patient and say, how are you feeling? What are you feeling? Where are you feeling it? And so the symptoms. The symptoms of arthritis, the first one is pain, all right? And that's probably actually why you came into the doctor and why you're having a visit in the first place is pain. It can either be short-term pain, maybe you just woke up with it, or maybe you hurt yourself in some way, shape, or form. Or it could be long-term pain. Maybe you've had it for 3 or 4 months, maybe 6 months to a year, and you're thinking, this isn't going away like it normally does. So pain, and it can be short-term or long-term pain. Doesn't really matter, can still be arthritis. Swelling, you may notice some mild swelling, and you may notice some really terrible swelling. And all of that is your body's reaction to the arthritis. So swelling. Stiffness. A lot of people with osteoarthritis complain of stiffness in the morning when they first wake up. One key factor of rheumatoid arthritis actually is stiffness in the evening. Not that that's a diagnosing factor, but just to think about. If you've got stiffness all the time, well, that's hard to say. Red and hot joint. I wanted to go over this for just 2 seconds, okay? Because one form of arthritis that causes a red, hot, swollen joint is an infectious arthritis, okay? For some reason, there's bacteria inside your joint, whether it's from a surgery or it could even just be a cut or a scrape near the joint. And that is an emergency, all right? If you have had a cut or a scrape and or surgery recently and your joint is just swelling up, maybe you have fevers, you need to go to the emergency room, or at the very least call your surgeon or your family practitioner and get in there, okay? It could be gout arthritis, it could be a couple of other forms of arthritis, but it at least needs to not be ignored, all right? So I'm not going to talk much more about that, but I did want to touch on that. Fevers and fatigue, that is a key factor of rheumatoid arthritis, actually. And so if you think that that may be something that when your joints are really painful and swollen and stiff, you also have fevers and you also have fatigue, well, then we need to be thinking about rheumatoid arthritis. So after we have an idea of, okay, this is arthritis, but we need to figure out what kind of arthritis it is, then me as your PA, I'm gonna order some x-rays on you. We should always do x-rays, okay? People kind of poo-poo the x-ray because they think that they need an MRI or a CT, and don't do that, okay? We need an x-ray, and the reason for that is most of the time x-rays can be done in the same day, and it can rule out some really big, bad, scary things like cancer. And I'm not here to scare you. I have literally, in my 7 years, I don't think I've ever diagnosed cancer from an x-ray thinking that it was arthritis, but we do need to do it. It's a good thing to do because if we go into the CT scan without an x-ray and we find cancer, we could actually be making it worse. So it's just, it needs to happen, even though a lot of people say, like, I've had x-rays of this joint before, or just a lot of different things. We just need to do the x-ray. One thing that I do want to touch on is radiation. A lot of people get concerned about the amount of radiation that they're receiving, but you in fact get more radiation from riding on an airplane, even a 45-minute flight, than you do from an x-ray, from a 2-film x-ray or 3-film x-ray. So just so you know, don't be worried about the radiation from the x-ray. From the x-ray, we can kind of judge whether or not we think that there should be a CT scan or an MRI. An MRI is going to look at the soft tissues of the joint, and so that will be if we want to rule out things like in the knee, if we want to rule out an ACL tear or a meniscal tear or something like that. Same within the hip, if we want to rule out a labral tear. In the back, we want to do an MRI and a CT normally, and so that's just a lot But in the back, we want to do an MRI so we can look at the spinal cord and see if it's compressed or not compressed. And we also want to do a CT scan so that we can see how much inflammation of the bone there is and if there's any fractures. So then we'll go on to CT scans. CT scans look at the bones and the hard structures of the body. So most often that's what we want to do if we're thinking of arthritis. Okay, it's going to show us how inflamed the bone is, and it's going to give us a good idea of how much space there is left in the joint. So any combo of these may happen to you when you go to the doctor. And then the last thing is labs, okay? If we think that you may have gout arthritis or rheumatoid arthritis, then we need to draw labs. Most practitioners will. Labs will include uric acid levels if we think that it might be gout. And then we're gonna say rheumatoid factor, okay? Rheumatoid factor and an ANA. And that's if we think that it's rheumatoid. And most of the time, if this is a new arthritis, I think most doctors, if they're going to draw labs, they're going to draw for both of those. The other thing that they will likely draw is a CBC, just to see if there is an immune response to anything, so that we can rule out what I talked about here of the infectious arthritis. The last thing, if you do go to the emergency room, a lot of times they may put a needle inside of whatever joint it is that's painful. And that can be twofold. It can be a treatment, which I'll talk about in the treatment video. But if we think that it's gout arthritis, we can pull fluid we can pull the synovial fluid out and look at it under a microscope. We can see if there's uric acid crystals in the fluid, which would then tell us that it's gout. We can look and make sure that there is no bacteria in the joint, which there should not be. And we can also just look and see if there is nothing, which then leads us to osteoarthritis. So that is my video on diagnosis of arthritis. Thanks for sticking around and learning how to diagnose arthritis. Hopefully we helped you narrow down what's going on in your body. The next video in this series is the treatment of arthritis, specifically the treatment that you can do yourself. No doctor's visit involved, no precious time and money spent. If you are interested in the entire e-course, check out the link in the description. And if you want more videos like this, then subscribe to my channel. Thanks and have a good day.